Let's take a look at an interesting new study that goes over vagus nerve stimulation and its effects on people with POTS, or postural orthostatic tachycardia syndrome. First, a quick overview on the vagus nerve for people that haven't seen some of my other vagus nerve videos. The vagus nerve is a cranial nerve that goes from the brainstem, and it innervates a lot of the internal body systems, including your lungs, your heart, your liver, your stomach, and a lot of your upper intestinal digestive organs. The vagus nerve is one of your primary parasympathetic nerves, and the parasympathetic nervous system is mostly associated with things that are involved with rest and digesting, meaning that it's turned on whenever you get into a state of relaxation, like if you're going to bed, or it's also activated more whenever you're about to eat a meal. But the most interesting thing about the vagus nerve from a clinical standpoint is that whenever the vagus nerve discharges, it's involved in a reflex called the cholinergic anti-inflammatory reflex. And what that means is every time the vagus nerve fires, acetylcholine is released, it goes into the digestive tract, and chemical messengers go to the spleen, and the spleen tells the white blood cells and the inflammatory system to start to calm down. And this is one of the main mechanisms that we have to reduce inflammation inside of the body. Scientists have used this effect to use vagus nerve stimulation as a way to treat different inflammatory disorders, including migraine headaches, autoimmune diseases, and even depression. So that brings us to a current study that was published this month, and it talked about non-invasive vagus nerve stimulation and postural tachycardia syndrome, a randomized clinical trial. So the authors basically took vagus nerve stimulators and attached it to a part of the ear called the tragus, which has fibers from the vagus nerve, and compared it to a sham group which used a fake stimulation which stimulated the ear lobe, which has no vagus fibers. Both groups were asked to stimulate their ear for 1 hour per day over the course of 2 months. And the main outcome measure was a change in tachycardia when they go from changing body positions, either laying down or sitting, up to a standing position. A patient with POTS is usually going to have an increase in heart rate of about 30 beats per minute or more when they change body positions. So they wanted to see what would happen. In this study, after 2 months of stimulation, the sham group still had an increase in heart rate over 30 beats per minute on average after 2 months of stimulation. But in the active group that got the actual genuine vagus nerve stimulation, you could see that their heart rate change actually decreased quite a bit into the 20 beats per minute range after getting stimulation. But the most interesting thing about this particular study is that the authors actually tracked the autoimmune components of the disease process. Because POTS is now being seen as an autoimmune type of an illness, they wanted to see if there's any changes in the antibody levels in patients that got vagus nerve stimulation. And the patients that got the real vagus nerve stimulation saw a decrease in the amount of antibody levels that may be contributing to the disease process, while the sham group did not see that type of change. So this was a small study, and some of the data about antibody levels does contradict some of the studies that they've done with vagus nerve stimulation in animals, but it does seem promising, and it does seem to fit some of the things that we've seen in our office when we've used vagus nerve stimulation on some of our patients with POTS. Now, some important things to consider: they did a lot of stimulation with these patients. They got 1 hour of stimulation per day, so they needed an at-home unit, and they were doing it daily for 2 months to see these types of changes and antibody levels and changes in tachycardia. In our office, we're doing shorter bouts of stimulation of about 10 minutes per patient per session, and we're only doing it maybe 2 to 3 times per week. So it's hard to say if what we're doing in our office would translate in the same way. But in our office, when we're doing vagus nerve stimulation combined with different types of rehab, we've noticed that patients, especially with POTS who have issues with fatigue and post-exertional malaise, using vagus nerve stimulation did serve as a way to get people to tolerate activities better than patients that, where we just try to jump them straight into a rehab process. Of course, it's a small study and needs to be replicated on a multi-center level with a much larger sample size to get a lot of confidence in these results. But it's good to see that this research is being done and that there are options that are being made available to patients with POTS that don't just treat the symptoms of tachycardia, but may actually treat some of the underlying autoimmune processes that are contributing to the disease itself.